So we're going to start by examining the clavicle. And the tricky part of the clavicle is figuring out which side is medial, lateral, superior, and inferior. The medial side is right here, and I know that because it's flat in the sagittal plane. If we take a look at it here, it has a very roundish kind of appearance and cross-section there. That's what attaches to and articulates with the sternum, specifically the manubrium. More laterally, it's flat in the axial plane and very kind of squished down. That's the more lateral or acromial surface of the clavicle. Then the superior surface is very smooth, and contrast that with the more roughened inferior surface. So inferior surface is rough, and there's a couple features to point out here. One, we have a real nice roughened area here very close to the sternal surface. And that is an attachment point for a ligament running between the clavicle and the first rib, thankfully known as the costoclavicular ligament. Further laterally, we have a bump near the apex of one of these S-curves and a little line extending from it. This is the conoid tubercle and the trapezoid line, where the conoid ligament and trapezoid ligaments respectively originate and then attach to the scapula. It's coracoid process, and collectively these are known as the coracoclavicular ligaments. Also on the inferior surface, we have a little smooth area right here. That's where the subclavius muscle runs between the clavicle and the first rib. Flicking it superiorly, we don't really see any roughened spots for muscle attachment, yet some muscles attach here. Very anteromedially, we've got the pectoralis major. Go a little further out this way and we pick up the deltoid anterolaterally, and the deltoid is going to continue down to the acromion of the scapula. Posterolaterally, we have some fibers of the trapezius attaching to the clavicle, and as we move a little bit more this way and tucking under, we have a bit of attachment here for the strap muscles of the neck, like the sternohyoid, sternothyroid. They may not only be coming off of the upper part of the sternum, which is the manubrium, but maybe a tiny little bit off of here as well. Now, real quick, I want to draw a little attention to the conoid and trapezoid ligaments attachment points here on this model, just because they're much more pronounced. So there's a very big conoid tubercle and a really much more pronounced trapezoid line. Kind of unusual to see them that well developed, but it does happen every so often. Now the next bone in the chain of the upper limb is going to be the scapula, and the scapula has a couple interesting features about it. So first off, we're going to start on its lateral border, right here. That's facing outward. The lateral border gives way to the inferior angle. Then the medial or vertebral border extends all the way across here. And finally we get to the superior angle of the scapula right up here, where it makes a little bit of a turn. I'm going to flip. And the superior border is generally interrupted by this region right here. This is going to be the suprascapular notch. And the suprascapular notch is just going to be medial to this extension right here called the coracoid, or thumb-shaped process. So the coracoid process is right here. Then we're going to travel to a little bump called the tubercle for the coracoclavicular ligament right there. And the neck of the scapula is a little bit odd to pick up. It's not really as demonstrable as other bones, but here there's a little bit of a narrowing just here. It's referred to sometimes as the neck of the scapula. And just lateral to that is the glenoid fossa, sometimes also called the head of the scapula. But the glenoid fossa is this indented area that's going to serve to be the site of articulation for the head of the humerus, which we'll get to in just a little bit. Now, to a variable degree, you may sometimes be able to pick up a little bump here and here that are the supraglenoid and infraglenoid tubercles, respectively. So they're not always super obvious, but this is where the long head of the biceps brachii tendon and the long head of the triceps brachii tendon will be attaching. So we've continued here, and we're back to the lateral border of the scapula. Now I'm going to flip it back here to its anterior surface, and this entire area is called the subscapular fossa, and it's where the subscapularis muscle originates. There are going to be a few lateral lines present here to a greater or lesser degree. So that you can see a couple of those pretty clearly on this sample. That is the subscapular fossa. We flip to the posterior surface, and the major feature here is this guy, the spine of the scapula. Kind of looks a little bit like the Nike swoosh if you kind of squint a little bit here, but the subscapular fossa on the front corresponds to the infraspinous and supraspinous fossae on the posterior side, both split by the spine of the scapula. And right here, the terminus of the spine of the scapula is this guy, the acromion, which articulates right there with the distal clavicle. And that is the only bony attachment of the upper limb to the rest of the body and the trunk. So we have the suprascapular notch right here, normally bridged by the superior transverse scapular ligament. And right here, this little separation, or the lateral extent of the scapular spine, is going to be referred to as the scapular notch. I've seen some places called the greater scapular notch, but that is where the nerves and vessels traveling into the supraspinous fossa are able to make their transition into the infraspinous fossa. There are several variations on the bony appearance of the scapula that are worth noting. So this scapula right here has an interesting feature in that right here, the suprascapular notch is interrupted by a bony bridge. So here we can see a little bit of a foramen formed right there, but bridged by bone. This marks the location of the superior transverse scapular ligament, which has in this case ossified. Another area of frequent variation in the scapula is in the shape of the glenoid cavity, the glenoid fossa. Now normally this is going to be surrounded by a glenoid labrum that deepens its articulation with the humeral head. This one's fairly symmetric, but it's not uncommon to find piriform or pear-shaped glenoid fossae as well. And there may or may not sometimes be an anatomical separation of the glenoid, the glenoid labrum right there, which can be mistaken for an artificial or pathologic separation of the labrum from the glenoid fossa. So those are a couple of the changes that can be seen in normal variation amongst people. Also, the shape of the acromion when viewed from above can be very variable depending on which individual you are looking at. So all those variations are possible, as is the occasional occurrence of an acromial bone. An acromial bone would be a separation between the spine of the scapula and the distal acromion and its articulation with the clavicle. This is a normal occurrence in some people, but can be mistaken for a fracture when it's present. Examining the humerus, we'll start with the superiormost portion right here, which is dominated by the large, bulbous humeral head, or head of the humerus, which articulates with the glenoid fossa of the scapula. There's a small groove between the head of the humerus and the rest of the bone. This is known as the anatomical neck, and it's where the ossification center for the head fused with the rest of the bone. Traveling a little further laterally, we come across the lesser tuberosity and the greater tuberosity of the humerus. Each has a stretch of bone extending inferiorly from it, called the crest of the inferior and crest of the greater tuberosity, respectively. And in between the two is the intertubercular groove, sometimes the intertubercular sulcus, for the long head of the biceps brachii tendon. Turning medially, this upper part is dominated by the head and articular surface of the humerus, but we can also see here a narrowing that's not a very sharp landmark, but where the head narrows to join the shaft of the humerus. This is referred to as the surgical neck, and is outside of the joint capsule and is a place where surgical access to the proximal humerus is frequently achieved. Turning laterally and posteriorly, we're dominated by the greater tuberosity of the humerus and its crest, extending inferiorly. And just on the lateral surface, a little further down the shaft, there's a roughened area. It's not terribly distinct in this specimen, but this is the deltoid tuberosity, and is the point of insertion for the deltoid muscle, focusing its fibers onto this one spot on the lateral shaft. Turning the shaft a little bit more posteriorly, we find a depression just inferior to the deltoid tuberosity, called the radial groove, and this is the location of the radial nerve and profunda brachia artery traveling down across the posterior side of the humeral shaft. We may be able to find the nutrient artery present, and its foramen just there. I'm going to bring it up closer to the camera, and you can look for the nutrient artery in just that oblique view as the artery enters the shaft of the bone. Now, looking at the inferior surface of the humerus, anteriorly we see the medial epicondyle and extending superiorly from it the medial epicondylar ridge. Likewise, on the lateral side we have the lateral epicondyle and lateral epicondylar ridge. Nice stout stretch of bone for muscle attachment. Just medial from there we find the rounded point of articulation for the head of the humerus. This is called the capitulum, and indeed the little fossa just superior to it is going to be the radial fossa, for when flexion of the elbow brings the radius in close approximation to the distal humerus. Then we have the trochlea, the point of articulation for the ulna, and likewise there's a fossa just superior to the trochlea. That is going to be where the ulna comes in close approximation with the humerus. That is going to be known as the coronoid fossa, as the coronoid process of the ulna is what comes close. Just inside we have the ulnar groove right here, and if I turn this posteriorly we can see the place where the ulnar nerve travels just across the medial epicondyle and can be prone to damage with fractures at this area. Having turned posteriorly, we can also see a large opening right here. This is the olecranon fossa, and that allows the olecranon process of the ulna to articulate with the distal humerus. It's worth noting that a non-pathologic variation in this area is this opening of the bone in the distal humerus. This is a supratrochlear foramen, although it goes by many other names, and is not pathologic, but it's just a thinned area of bone connecting the coronoid fossa with the olecranon fossa. Moving into the forearm, the first bone we'll look at is the ulna. The ulna is particularly notable for its large attachment site for the triceps brachii muscle, the olecranon, located right here. The olecranon has a trochlear notch extending inferiorly from it, and this is what articulates with the trochlea of the humerus. There is a small ridge in the middle, it's not very pronounced on this specimen, called the guiding ridge, that keeps it locked roughly in the same place on the humerus so that it acts as mostly a hinge joint, although there is a little bit of condylar motion possible at the elbow. So we extend further down, we come to the large coronoid process right here, which fits into the coronoid fossa of the humerus. Extending just off to the lateral side of that, we have the attachment site for the ulnar collateral ligament, at least its anterior band. This is sometimes known as the sublime tubercle. Moving to the other side, we find the articulation point for the radius, the radial notch, which is a nice pronounced divot right here, containing a synovial joint that articulates with the radial head. Extending down from there, we have the supinator crest and the nearby supinator fossa, where the muscle supinator originates. The ulnar tuberosity is this roughened patch just here, and it's the attachment site for the brachialis muscle. The shaft of the ulna continues down inferiorly, and like any long bone, has to have at least one nutrient foramen. Here you can see it just there, entering the bone obliquely. As we travel a little further laterally, we see a sharp edge. This is the interosseous border of the ulna, and it attaches to the radius by means of the interosseous membrane. It extends a good long way down until we reach the head of the ulna. The head of the ulna is most pronounced for this styloid process, the ulnar or medial styloid process. And then, just on the posterior side, there's a nice perceptible groove for the flexor carpi ulnaris muscle tendon, traveling through there. And then we have an articulatory surface for the radius on its border, and then looking straight down at it we have a location of the articular disc. Since the ulna itself barely articulates with the carpal bones in a bone-to-bone manner, we have a cartilaginous or fibrocartilaginous disc present on this surface that allows the ulna to articulate with the carpal bones. Now the other bone of the forearm is the radius, and the radius is very notable for its very pronounced radial head, this expanded portion at the top that has an articular surface for the capitulum of the humerus, and then a circumferential articular surface with which it articulates with the ulna. This gives way to the thin, or relatively thin, radial neck, and then the pronounced radial tuberosity just here is where the biceps brachii tendon is going to insert. The shaft of the radius is pretty much the extended long portion. There is a nutrient foramen, which is pretty subtle in this specimen, but I'll try to get that visible for you right there. There's a very sharp interosseous border with which it articulates with the interosseous border of the ulna. And if we look at the anterior surface here, there's a little bit of an anterior border right there, not as pronounced as the interosseous border, but present. And if we flip, there's once again not quite as pronounced but present posterior border of the radius as well. Now, examining the distal portion of the radius, you can see the enlarged portion here is where we articulate with the carpal bones. Now, the first thing I want to draw your note to is this notch right here. This is the ulnar notch. This is where the radius articulates with the head of the ulna. If we move just a little bit dorsally from there onto the posterior surface of the radius, we can see a few different little grooves and a pronounced bump right here. Now, right here, this pronounced bump is the dorsal radial tubercle, also known as Lister's tubercle, and extending from the ulna towards it, we're going to have little grooves for the extensor digitorum and extensor indicis muscles, rather their tendons. Then a little elevation right here marks the site where we have a groove for the extensor pollicis longus muscle and tendon, then the radial tuberosity, and this flattened surface here is where the tendons for the extensor carpi radialis longus and brevis will be traveling, and just on this furthest extent we might see a little groove that's not too pronounced on this specimen for both the extensor pollicis brevis and abductor pollicis longus tendons. Now that we're on this side, we can note this elevation pointing very much distally, and this is the radial styloid. So radial or lateral styloid process is just here, and if we look inferiorly at the articular surface from the radial styloid, we've got the articulatory surface for the scaphoid bone, the carpus, and a little bit further towards the ulna is the articulatory surface for the lunate bone. Extending from here, we'd have the ulna and its articular fibrocartilage disc, and that would be what forms a complete cup that allows the radius, ulna, and carpal bones to articulate with each other. Now, before we move on to the carpus and the bones of the hand, I'd like to draw your attention to how the radius and the ulna actually articulate with each other. So here we have the ulna and radius, and the radial head and the annular ligament that surrounds it and tethers it to the ulna allows both supination with the palm facing upward and pronation, wherein the radius distally rides across the ulna remaining fixed in place, and the radius moving across to take the palm of the hand and direct it inferiorly. So rotation up here at the radial head in conjunction with the radial groove of the ulna allows pronation and supination to occur, and then here the ulnar notch of the radius articulates with the head of the ulna to allow it to pronate and supinate distally as well. Now, this attachment doesn't really give us a great deal of ability to visualize radial deviation and ulnar deviation, but those motions are possible at the wrist, at the radiocarpal, junction right here with the ulna having a fibrocartilage disc present between it and the carpal bones. And this is also where a degree of flexion and extension of the wrist is going to be possible. Next, we'll discuss the bones of the carpus in the hand and how they articulate with each other. We're going to review the bones of the carpus and the hand in an articulated specimen. Starting from a dorsal view, we're going to start with the proximal row here. On the radial or lateral thumb side, we've got the scaphoid, the lunate, the triquetrum, and flipping it over here just a bit, we have the pisiform. Then onto the distal row, we have the trapezium, the trapezoid, the capitate, and the hamate. Now let's go through the same set of bones from a palmar view. Once again, scaphoid, lunate. Turn it here so you can actually see the triquetrum because it's mostly obscured from a palmar view by this bone, the pisiform. Then we're going to have the trapezium, trapezoid peeking out there, capitate, large bone there, and then the hamate with its characteristic hook. As we move into the bones of the hand itself, these are the metacarpals. First, second, third, fourth, fifth, and then we move out onto the actual free portions of the digits. These are plural, the phalanges. We have a proximal and distal phalanx. For the thumb, only two, but for the other digits, 2 through 5, we have a proximal, a middle, and a distal phalanx. And the joints that we see here are the metacarpal phalangeal, proximal interphalangeal, and distal interphalangeal. All the joints here between the carpal bones and the metacarpals and between the carpal bones themselves are named for the articulations that are present. Now to look at the carpal bones in more detail, we'll start with the scaphoid right here. You can see it has a large rounded surface that articulates with the radius. There's a scaphoid tubercle right here, and a thinning area that's sometimes referred to as the neck of the scaphoid. And fracture of the scaphoid typically occurs in this region. There are articular surfaces not only for the radius, but also for the capitate, right there, for the lunate, right here, for the trapezium, and the trapezoid. We'll flip it and see a little bit of the same. Here's the articular surface for the radius, and then once again it articulates with the lunate, the capitate, a little bit with the trapezoid, and significantly with the trapezium. Moving on to the lunate itself, we'll flip it back to its dorsal view. The lunate also articulates with the radius on this smooth proximal facing surface right there. And it's got additional articulations with the scaphoid, the capitate, the hamate right here, and the triquetrum. Now the triquetrum itself articulates with the lunate, the hamate, and it's the only bone that articulates with the pisiform bone. And this bone projects in a palmar angle right there. Now the pisiform itself, once again, articulates exclusively with the triquetrum right there, and has a very, very subtle groove on this side for the ulnar artery. So subtle, in fact, it's very much not a feature I can point out on this, but some pisiforms do have at least a demonstrable groove for the ulnar artery. Now, moving on to the distal row of carpal bones, we have the trapezium. Trapezium has a significant interaction or articulation with the first metacarpal, and they have a very nice saddle-shaped joint, allowing them to articulate together, and that's what allows the thumb a large degree of its mobility. So the trapezium also articulates with the second metacarpal, the trapezoid, and the scaphoid bone. If we turn it onto its palmar side, we can also note one unique feature to it, and that is the palmar ridge of the trapezium. And just medial to that is a short groove where we can find the tendon of the flexor carpi radialis. Now turn the wrist back and move to the next bone of the distal row, that is the trapezoid. The trapezoid bone is fairly stout dorsally, where we can see it articulating with the trapezium, the second metacarpal, possibly a little bit with the third metacarpal, definitely with the capitate and scaphoid. But when we flip it to look at its palmar view, there's not as much of it poking out, and that's because it's relatively wedge-shaped, larger on the dorsal side than on the palmar. Then we move on to the capitate, very large bone right here, and it's articulating by its head, this large rounded section here, with the scaphoid, the lunate, possibly a bit with the hamate right there. Then we have its little narrowed neck and body up here. The neck and body are articulating with the trapezoid, a small amount of articulation with the second metacarpal, a large articulation with the third metacarpal, and a small articulation with the fourth metacarpal. There's a very small but sometimes palpable styloid projection of the capitate on this dorsal medial surface. And last but not least, we move on to the hamate. From this view, the hamate clearly articulates with the capitate, the fourth metacarpal, the fifth metacarpal, the triquetrum, and the lunate. When we turn it onto the palmar side, we see the most pronounced feature of the hamate, that is the hook or hamulus of the hamate. So the hook of the hamate is this large feature here, forms part of the carpal tunnel that allows the flexor tendons and median nerve to enter the palmar aspect of the hand. And we can see it again articulating with the triquetrum, the lunate, the capitate, and maybe a small amount with the third metacarpal, but definitely significant articulations with the fourth and fifth metacarpals. Now regarding the metacarpals themselves, they're made up of a head, a shaft, and a base. The bases tend to be broad, sometimes have either a W or perhaps a little saddle shape to them as they articulate with the carpal bones. You'll note from a palmar view that they have significant hook coming out as we approach the head right there. That's how we know it's on the palmar side. And then we reach the individual phalanges or a phalanx. They mirror the metacarpals in a way because they have a head, a shaft, and a base, and we can see that present on each as we go from proximal to distal. One thing to note is that the metacarpal phalangeal joint, the heads of the metacarpals tend to be rounded, and the base of the phalanx that is articulating with it is concave, whereas the proximal and distal interphalangeal joints have a similar morphology but tend to be a little more saddle shaped. You can see a little bit of a groove present in the middle of that articulation. Alright, and that takes us through the bones of the upper limb. Next step will be to look at how the muscles attach to these bones. Now we're going to look at the bones of the upper limb in a slightly different way by looking at their sites of muscle attachment. Muscle attachments can be loosely grouped as origins, which I've colored here in red, and insertions, which I'm coloring in blue. Origins tend to be more stable sites of muscle attachment, and the insertions tend to be more mobile sites. So that's one way you can describe muscle activity, is by bringing the insertion sites closer to the origin. That breaks down a little bit with some muscles, but it's a fairly handy little trick to use to figure out a muscle's origin. Here's the clavicle's medial side, lateral side, anterior and posterior side. On the medial posterior side, we have the origin of the sternocleidomastoid. A little more anteriorly and medial, you have the broad origin of the pectoralis major's clavicular head. Distally, we've got, on the lateral side, the deltoid muscle's origin, its anterior belly in particular, and just a bit posteriorly and laterally we have the attachment site for the trapezius muscle, or a small portion of the trapezius muscle at least. We'll see the rest of it in a moment. And we flip to the medial posterior side, and we have some of the strap muscles of the neck attaching here. Sternohyoid muscle tends to be one that originates here instead of from the sternum, from its very close neighbor, the proximal medial clavicle. And here on the inferior side we have a green area. This is where the costoclavicular ligament from rib 1 to the medial clavicle is inserting. Just past that we have the insertion site for the subclavius muscle. The subclavius muscle is going from rib 1 to the clavicle, and it helps keep it stable and prevents the clavicle from distracting too much if it gets fractured. As we move laterally on the inferior side, we have the corticoclavicular ligaments, specifically the conoid and trapezoid ligaments. Now let's flip this back to the superior view and bring in the scapula. Here's the scapula. We'll go through its muscle attachments in detail in just a moment, but I want to see if we can visualize here how the deltoid and trapezoid muscles really do bridge the two bones. So anteriorly we have got the anterior belly of the deltoid. As we cross onto the acromion of the scapula, we have the middle belly of the deltoid, and across the spine of the scapula, the broad posterior belly of the deltoid originates. Now here we've got the attachment, little curve, followed by the trapezius muscle, which allows it to elevate and retract the scapula along the body wall. And now we'll take a little bit more look in detail at the scapula. Posteriorly, we've already noted the spine of the scapula and the acromion. It divides the posterior side of the scapula into an infraspinous and supraspinous fossa. No big surprise, the supraspinatus muscle originates from the supraspinous fossa. Just medial to the scapular notch, we have the small origin of the omohyoid muscle, and in the infraspinous fossa we have the origin of the infraspinatus muscle. A little further inferior we have the origin of the teres major and teres minor muscles, and now we're going to look at the medial side of the scapula, and we've got the very broad attachment insertion site of the rhomboid major. At the base of the scapular spine we have the attachment insertion point of the rhomboid minor, and here near the superior angle on the medial surface of the scapula is the attachment and insertion site for the levator scapulae muscles. Now we flip the scapula and take a look at its anterior surface, and it's dominated by the broad subscapular fossa. And again, not surprisingly, the muscle that's originating here is called the subscapularis. But also note the insertion along this large C-shaped course from the inferior angle across the medial border to the superior angle of the serratus anterior muscle. Right here we can see again the omohyoid originating just medial to the scapular notch. As we go across the scapular notch, we go on to the coracoid process, and here are the conoid and trapezoid ligaments, which are the corticoclavicular ligaments. And then we have a little blue dot, and that is the insertion point for the pectoralis minor. Coming from the anterior chest wall, inserts on the medial aspect of the coracoid process, and right out on the tip of the coracoid we have the the origin for the coracobrachialis muscle and the short head of the biceps brachii. Here, on the extreme lateral border of the scapula, we have just below the glenoid fossa, along the infraglenoid tubercle, the origin site for the long head of the triceps brachii, and off the supraglenoid tubercle we have the origin of the long head of the biceps brachii. Now the last feature I want to show on the scapula is here on the underside and really along the very distal lip of the acromion is the attachment site for the coracoacromial ligament, which spans and makes a little roof across this space right here. Let's take a look at the muscles of the clavicle, scapula, and how they move towards the humerus by checking out the Netter Atlas of Human Anatomy 6th edition. Thanks again to the fine people at Elsevier for allowing me to use this in the videos here. We're going to flip over to plate 409 to get started and zoom in a little bit here on the muscles of the back. So to start with, we can see how the trapezius muscle here is attaching to the spine of the scapula, moving around to the acromion. Likewise, on its underside, we can see how the deltoid's posterior belly and a little bit of the middle belly are originating right there. Just deep to this stout fascia, we'd find the infraspinatus muscle, and here is the teres major, and just above it, teres minor. On this side, we've removed the trapezius, and you can see a little bit more clearly the muscles on the medial border, like the levator scapulae, the rhomboideus minor, and rhomboideus major, inserting onto its medial border. With the trapezius out of the way, though, it's really easy to see the supraspinatus muscle coming from the supraspinous fossa out towards the humerus, and the infraspinous muscles, multiple bellies, going towards the head of the humerus right there and across to the greater tubercle, and teres major once again, and teres minor. So we're going to scooch down to the bottom of the page and take a look at the anterior aspect, and we can see pectoral muscle. Even though it has a significant origin from the ribs and sternum, there's a pretty decent amount of muscle fiber coming from the anterior medial clavicle right here, and here's that middle and anterior belly of the deltoid, likewise coming off. From this view, it's a little bit easier also to see how the trapezius does have some attachment to the distal clavicle, and here's that sternocleidomastoid inserting not only onto the sternum, but also onto the clavicle right there. One thing I want to note is we can see some fibers of the serratus anterior right here. To see those a little more clearly, we're going to flip to the next page. Now this illustration is coming from the ridiculously talented Carlos Mercado, but it takes a little bit of breakdown to see what's going on here. So, flatten that out. This is an anterior view, and in this case, we've cut the pectoralis major and pectoralis minor. Here we can see pectoralis minor as it's stretching to insert onto the coracoid process. Off the coracoid process, we can also see the coracobrachialis and short head of the biceps brachii. They're going to be found just deep to the deltoid, which has been incised right there. So, deltoid, short head of the biceps, coracobrachialis, pectoralis minor, going all in relation to the coracoid process. Here is where we'd find the scapula, and it's not really visible because the supraspinous muscle, supraspinatus, in other words, right here, is completely obscuring the bone, but we can see the tendon of the muscle heading towards the humerus. Likewise, here's the teres major, and its insertion near the insertion of the latissimus dorsi. One cool thing about this illustration is it's showing the serratus anterior, but one thing that's a little difficult to see and get the three-dimensional sense of here is that these muscles are originating from the ribs on the lateral wall of the thorax, but they're inserting onto the medial border of the scapula, right along this angle here. So that's a little bit of the sense of the muscles that are going from the thorax and clavicle and scapula to the upper limb. Now let's keep going and take a look at the humerus itself. Now here is the humerus, and once again we've colored in red the origin sites and in blue the attachment sites for the muscles. And starting at the head of the humerus, right here on this region, the lesser tuberosity, we've got the insertion site for the subscapularis, and a little bit over lateral we have the greater tuberosity for insertion of the supraspinatus muscle. Now on the anterior side, a little bit further down, we can see the attachment sites for the teres major, latissimus dorsi, and pectoralis major. Please note that the latissimus dorsi and teres major insert very close together on the crest of the lesser tuberosity, and the pectoralis major is a broad insertion on the crest of the greater tuberosity, and that it's separated from the insertion of the latissimus dorsi by the intertubercular sulcus right there, or the humeral groove, sometimes called. We go a little further down and we have on the lateral side the singular attachment point for the deltoid muscle laterally, and medially we have the attachment for the coracobrachialis. Now I'm going to flip to the posterior side so we can see the remaining attachment sites here. We had supraspinatus, and here we have infraspinatus and teres minor. Now we're going to look at the origins. Back on the anterior side, we have on the anterior part of the shaft the very broad origin for the brachialis muscle off the anterior portion right there. We go a little bit down here towards the medial epicondyle, and we have the origin site for the pronator teres, and the common flexor tendon origin for many of the flexors of the wrist and the digits. We'll go into those in a little bit more, but basically the flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, all originate from a common tendon right there. Over on the lateral side, anteriorly, we have the origin of the brachioradialis muscle, and then the extensor carpi radialis longus, and a common extensor tendon on the lateral epicondyle. This is where extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, all of these originate from a common tendon out here on the lateral epicondyle. Now we flip to the posterior side and we fill in a few of the blanks. Here is the lateral head origin site, lateral head of the triceps brachii, and very extensive posterior origin of the medial head of the triceps brachii. We go a little further inferiorly, we can see a little bit more extensive kind of appearance of that medial epicondyle on the common flexor origin, and right back here is the insertion point for the enconeus muscle, originating right there. If we put the scapula together, we can see a little bit more easily how these muscles move from one side to the next. Subscapularis originates here, inserts here. Hence, when it contracts, it's going to help medially rotate the upper limb. The serratus anterior here inserts onto the scapula, so it doesn't really affect the humerus other than moving the scapula. Here we have the origin of the short head of the biceps brachii, which actually travels all the way down to the radius. We'll see it in a bit. But we also have the origin of the coracobrachialis, which goes from here to here. So it's going to help adduct and slightly flex the humerus at the shoulder joint. Pectoralis major right here came from the chest, and latissimus dorsi and teres major are right next to it. Teres major coming from here and originating from right here. So both teres major and latissimus dorsi are going to help extend the shoulder at the glenohumeral joint right there. And here, coming from the supraspinatus muscle's origin to its insertion right here, is the muscle that allows us to initiate abduction. So supraspinatus brings those 2 points closer together, initiating abduction. Now we flip to the posterior side, and we've got the origin and insertion of the infraspinatus muscle. We have the origin right here and insertion of the teres minor, and both of these are going to be lateral rotators of the humerus as they bring these points closer to these points. Now from there we have one muscle left, that is the long head of the triceps, which combines with the lateral head of the triceps and the medial head of the triceps, and will insert onto the ulna, which we'll see shortly. Now, when looking at the muscle attachment sites related to the radius and the ulna, it makes a lot more sense to look at them together. So here on the proximal radius, we have the radial tuberosity, where we have the tendon of the biceps brachii inserting. Just across from it on the ulna, proximally, we have the attachment site for the brachialis muscle. And as those are both major flexors of the forearm at the elbow, that makes a lot of sense. Over here, in this blue strip, which goes a little bit lateral out onto the radius, we have the attachment site of the supinator muscle coming from the common flexor origin. And right here, a little further down, is the attachment site of the pronator teres. That'll make a little more sense when we look at the back of the radius. Here is the pronator quadratus muscle, and very far out here is the attachment site for the brachioradialis muscle, stretching all the way from the humerus down to the distal radius. Here, kind of the red that's just kind of tucked in right behind there. There you can see it. That is the attachment, or pardon me, the origin site for the supinator muscle. And the supinator muscle also is going to run from here across to the other side here and cause supination of the radius, which is going to be equivalent to bringing your hand palm up. So let me slide this guy back where he was. Now here, this little strip right here is the radial head for the flexor digitorum superficialis. And then here, in this little L-shaped but much more broad origin site, we have the flexor pollicis longus muscle, or the muscle that's going to flex the thumb. Here, a very broad attachment site for the flexor digitorum profundus. And this actually goes out onto the interosseous membrane, which is going to be a kind of collagenous membrane stretching between these two bones along this way. Further distally, we have the origin of the pronator quadratus, and by bringing this closer to this, we would get pronation, which is going to be the opposite of supination, bringing my hand palm down. Now, before we flip completely, let's take a look at a few small sites on the radius and ulna. Here on the ulna, we have a small site of origin for the flexor digitorum superficialis. Right here we have an origin site for the pronator teres, right there. And we can see how broad this origin site is for the flexor digitorum profundus, or the deep digital flexor. Moving across to the more medial side of the ulna, we have a little strip right here. This is going to be the origin site for the extensor carpi ulnaris. And just a little further on the posterior side, but stretching all the way from the olecranon above down the shaft, is going to be the origin for the flexor carpi ulnaris. Now, reflecting a little bit further, we're coming on to the more medial side of the ulna, and here we can see the origin for the for the supinator right there. Here's adductor pollicis longus, and just a little bit right there for extensor indicis, the one that allows us to extend our index finger specifically. Now, I haven't really brought up these other attachment sites for insertion yet, but they're important. Right here on the olecranon, that is where the tendon of the triceps brachii inserts, and that's the strong extensor of the elbow. And here is the broad attachment site inserting for the anconius, another extensor of the elbow. Let's take a look at the radius and see it as well. We flip, and now looking at the radius's posterior side, we have a very broad site of attachment for the supinator. Since the radius is the more mobile of the two bones, it both allows supination and pronation to occur by moving of the radius. So the insertion sites for both muscles are going to be on it. Here we have the pronator teres muscle inserting just a bit more distally to the insertion site of the supinator. And here we already saw the anterior side and how we have the flexor pollicis longus there. Flipping it onto its posterior side, we can see the abductor pollicis longus origin site, and a little more distally the extensor pollicis brevis muscles origin site right there. So I'm going to put these guys back together, but with the posterior view being a little more prominent, and I'm hoping we can see how some of these attachment sites actually bridge both bones. Remember, in life there's actually a membrane between these guys, the interosseous membrane, that allows the attachment sites to be spread between both bones. In this case, the origin of the abductor pollicis longus comes from here across the membrane to here, and here we have the extensor pollicis longus extends onto the membrane, but not all the way to the radius. And here's where we have the extensor pollicis brevis muscle originating, and lastly the extensor indicis here on the distal ulna. Alright, before we move on, let's just take a look at the humerus and then forearm bones, the radius and ulna, together and see how some of these muscles spread across the joint. Here we have the origin of the brachialis muscle of the humerus, and that's going to be inserting right here on the ulna, hence making it a strong flexor of the forearm. Here's the insertion site of the biceps brachii, but the biceps doesn't originate from the humerus at all. It's originating from the scapula, both the coracoid process for the short head and the supraglenoid tubercle for the long head, making it a muscle that spans two joints, both the glenohumeral joint and the elbow joint right here. Now, looking a little further down, we see the common flexor origin here off the medial epicondyle. Most of the muscles originating from here don't insert onto the forearm at all, but down to the carpus and bones of the hand. But we do have the pronator teres originating right here and traveling down across to the opposite side of the radius. And so when it actually wraps around the radius and contracts, it's going to bring the radius across into pronation right there. So if I did that, it would be me doing this. That's pronation. Likewise, off the common extensor origin, we have some of the supinator muscles fibers originating, and they are going to wrap around and attach to the radius, and they're going to attach to it right there, kind of tucked in a little bit behind. And it's going to have the opposite effect. A hand that's pronated, when those muscles contract from here across, are going to pull it into supination, like so. Alright, now I'm going to flip this whole situation over so you can view the forearm from the posterior side, like so. And really the entire point of this is to show you that the triceps muscles, both the lateral head here, the medial head's very extensive origin here, and even the long head, which is coming off the scapula's infraglenoid tubercle, all focus their fibers onto the olecranon right there, making it a very focused and very strong extensor of the elbow. Here we have the anconeus muscle, which is bridging from here to here. So it's helping stabilize the elbow joint as well, and is an extensor of that joint, although nowhere near as powerful as the triceps. From the posterior side, we can see here the pronator teres and supinator attachments on the radius. Let's once again return to our buddy Netter's Atlas of Human Anatomy, 6th edition. Thanks again, Elsevier. And look at the anterior arm and see how these muscles are bridging from the humerus and scapula to the radius and ulna. Here we have, off the coracoid process, the coracobrachialis, short head of the biceps, which is joining the long head of the biceps, and comes down slightly laterally to reach the radial tuberosity. Now note, there is a little bit of an aponeurotic attachment that goes medially and inserts onto the connective tissue of the forearm, which also helps the biceps flex, but also do a bit of supination and isn't really reflected in the bony attachments. Nearby, we have the brachialis muscle, which is deep to the biceps. You can see it much more clearly here where the biceps brachii has been removed. Here's the insertion of the deltoid, just lateral and superior to the origin of the brachialis. And here you can see a little more extensively the coracobrachialis muscle coming from the coracoid to the actual humerus. Now here, down on the elbow, we have the brachioradialis coming off laterally, and on the medial side is the pronator teres and flexor carpi radialis. Now looking at it from a posterior view, we can see how the long, lateral, and deep to these, the medial head of the triceps muscle, shown here very deep underneath, focusing their attachment onto the olecranon of the ulna right there. Right nearby is the common flexor origin off the medial epicondyle, and this illustration showing flexor carpi ulnaris present there. Here we've got the anconeus coming from the lateral epicondyle to the ulna, and also off the lateral epicondyle we have the common extensor origin. Brachioradialis up here, but traveling more anteriorly, as well as the extensor carpi radialis longus, extensor carpi radialis brevis, and right here we're going to have extensor digitorum going out towards the fingers. Now, looking at the carpal and metacarpal and phalangeal bones right here, starting on the first metacarpal, we can see in blue the attachment for abductor pollicis longus. We move on to the second metacarpal, and at its base is the insertion for extensor carpi radialis longus, and no surprise, just nearby, sometimes bridging second and third metacarpal, is the attachment site for extensor carpi radialis brevis. And if these are pulled upward, they will indeed extend the carpus. Moving more medially, here at the lateral base of the fifth metacarpal, we have the extensor carpi ulnaris insertion point, which will extend and ulnar deviate. And here, moving out onto the phalanges, right here at the base of the phalanges, on the medial side of the fourth, medial side of the third, lateral side of the third, and lateral side of the second proximal phalanges, we have the insertion points for the dorsal interossei. These muscles actually originate here from the red areas between adjacent metacarpals, hence the name interossei. So these muscles originate here, insert here, and they're going to be responsible for abducting, or pulling the fingers away from the midline right there. So dorsal interossei abduct out here at the posterior or dorsal base of the intermediate phalanx and distal phalanx. We have the insertion point for the extensor digitorum muscles, most particularly right here. And we have the extensor digitorum also having some extension right here. So the bands of the extensor digitorum insert both places, allowing them to extend the metacarpal phalangeal and, to some degree, the proximal and distal phalangeal. Some muscles called lumbricals are also going to help in extension of the PIP and DIP by straightening and stretching those, and have their effect through these insertion sites right there. Now the palmar side of the wrist and hand is a bit more complex, so let's start with the pisiform bone right here. We can see in blue the attachment site, or the insertion of the flexor carpi ulnaris. Nearby, here on the fifth metacarpal, is the insertion point for the extensor carpi ulnaris. So a flexion here, extension here, and moving all the way across here to the capitate, the trapezoid, and the base of the second metacarpal, we have a little broad area for insertion of the flexor carpi radialis muscle, again helping to flex the wrist at the carpal bones right there. Now moving over to the radial side, we have a little dot here and a little dot here. These are going to be the origins for the abductor pollicis brevis, and they actually insert right here at the base of the first metacarpal to help abduct the thumb. Just palmar to that on the trapezium is going to be the origin of the opponens pollicis, and a little bit further down on the same bone will be the origin of the flexor pollicis brevis muscle. Now those are going to be inserting onto the thumb right around here and helping to flex it, but also to oppose it to help bring it across into closer approximation with the fifth digit. Moving along a little further, here's a little L-shaped origin, and this is part of the origin of the adductor pollicis, and so is this. Two heads of the adductor pollicis, here and here, are going to attach to the thumb right here. And that is going to be what allows the thumb to be pulled in and close to the other digits. Moving a little bit more medially, here we've got one little dot on the hamate, and that little dot is also sharing a muscle origin with this little dot. These guys are the origin of the opponens digiti minimi. and the opponent's digiti minimi, and this little dot, which is going to be the origin of the flexor digiti minimi brevis, are going to insert onto the 5th digit. The flexor digiti minimi is going to be inserting right around here, whereas the opponent's digiti minimi is going to be inserting right around here. So again, opposition would be bringing the little finger, the 5th digit, and the thumb, the 1st digit, together, whereas flexion is going to be that right there. Next, we're going to look at the origins of these muscles from the metacarpals. Now, we already mentioned this little strip right here. This guy is going to be the origin of the adductor pollicis muscle, one of its heads, but we've also got this muscle, and this muscle, and this muscle. Now, these are going to attach from within between bones, so these are interosseous muscles once again, but they're going to attach to this spot on the 5th, this spot on the 4th, so the radial side of the 5th and the 4th proximal phalanx, but the medial side of the base of the proximal phalanx of the 2nd digit. Long story short, these interosseous muscles are going to adduct, or bring the fingers closer together, and they're going to bring the fingers closer to the 3rd digit. You'll notice none of these palmar interossei are inserting onto the 3rd digit. It's because it can't adduct any closer to itself. It is the reference point that the body is used for what is adduction and what is abduction. So any movement it makes is abduction. And as we already talked about, those insertion points are here and here, coming from the dorsal interossei. Okay, let's flip it back over, and the last pieces we need to put together for motion of the thumb will be in this one right here. We have the opponent's pollicis muscle inserting here, but we have the abductor pollicis brevis and flexor pollicis brevis muscles inserting here at the base, the lateral aspect of the base of the 1st phalange of the 1st digit, right there, and here, once again, on the medial side is where we have the adductor pollicis muscles inserting. Right here at the distal end, on the palmar side, distal phalanx, we have the insertion point for the flexor pollicis longus, which is going to allow us to flex that interphalangeal joint there. Likewise, on digits 2, 3, 4, and 5, we have insertion for the flexor digitorum superficialis, or the superficial digital flexor, onto the middle phalanx on each side, and on the 3rd distal phalanx for digits 2, 3, 4, 5, we have the insertion point at the base for the flexor digitorum profundus, also known as the deep digital flexor. What that means is that the superficial digital flexor can flex the MCP, metacarpal phalangeal, and the PIP, proximal interphalangeal joints, but only the flexor digitorum profundus, or deep digital flexor, can flex the distal interphalangeal joint right there. So when you make a strong fist, all of those flexors are working together, but only the flexor digitorum profundus will allow you to flex that distal interphalangeal joint. Alright, let's return to Netter's Atlas of Human Anatomy. Here's the common extensor origin. We can see the extensor tendons here, long head of the extensor carpi radialis, extensor carpi radialis brevis right there. These both cross on the lateral side of the wrist, and we're going to insert on the 2nd and 3rd metacarpals with a little bit of possible bridging between the two right there. Just next to them we have the extensor digitorum muscle, which crosses the carpus and across the metacarpals to go across the metacarpal phalangeal as well as the proximal and distal interphalangeal joints to help extend all of those joints. Nearby, we've got the extensor digitorum giving off branches to each one of these digits, but sometimes having multiple crosslinks between them. We also have the extensor carpi ulnaris inserting here on the posterior or dorsal side of the 5th metacarpal right there, and a little bit deep to all these guys, we also have muscles going to the thumb. We have the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus right here, all traveling to the thumb. Note that the extensor longus makes it to the distal phalanx, whereas the short extensor of the pollicis, or extensor pollicis brevis, only makes it to the proximal phalanx right there. Nearby we have the extensor indicis coming off the radius and a little bit of the interosseous membrane and joining the extensor apparatus here, going across the posterior aspect of the first finger, aka the second digit. Now we take a look at the flexors, and things look a little bit different. Flexors here on plate 432 are going to be coming primarily from the medial epicondyle. So here, crossing the wrist, we have the flexor carpi radialis muscle. Then we have the flexor carpi ulnaris muscle, both of them going down towards the wrist. Let's take a look at plate 452, and we'll zoom in just a little bit right here to get a better view. Now, pisiform bone right here, we can see the flexor carpi ulnaris tendon coming in to insert there. Coming off of it, we can see the abductor digiti minimi, which is traveling up this way towards the fifth proximal phalanx's base. Then just beside it we have both the flexor digiti minimi brevis and its attachment right here, and deep to both we have the opponens digiti minimi right there. Moving across to the lateral side, here's the extensive adductor pollicis going here towards the base of the proximal phalanx of the first digit, and here we've got the abductor pollicis brevis muscle coming from here to here. We have the flexor pollicis brevis muscle, a little bit more medial from here to here, and then deep to both we have the opponens pollicis right here. One thing that is visible in this view is going to be that we've got the palmar interossei in between the bones. For a better view, we'll just look at the bottom part of the same page. The palmar interossei are coming from the 5th, 4th, and 2nd metacarpals and inserting onto the base of their own proximal phalanx. This is going to allow them to adduct towards the third digit, which has no attachments for palmar interossei. If we were to flip the hand and looking at the palmar aspect here, we'd notice that there are dorsal interossei in between the first and second, second and third, third and fourth, fourth and fifth metacarpals, and they are going to insert onto the proximal phalanx nearby in such a way that allows it to abduct. So the third digit has insertions on both its radial and ulnar side because any motion it makes is defined as abduction. And then when the fourth digit abducts, it moves towards the ulna. When the fifth digit abducts, the abductor digiti minimi moves it in ulnar deviation. Likewise, the third digit can abduct radially, as can the first the first dorsal interosseous can abduct the second digit right there. And once again, the thumb has its own separate abductor muscle since there's no other bones for those interossei to span right there. Alright, I hope this has been partially illuminating, and thank you very much.